of the Master's of Science in Health Policy and Economics at Weill Cornell Medicine in New York City. My name is Ariane Jung, and I'm an Assistant Professor of Healthcare Policy and Research. I'm also the Director of the MS in Health Policy and Economics.
And I'm Mark Unruh, Assistant Professor of Healthcare Policy and Research.
So if you have any questions during this presentation, please feel free to type them directly into the chat window on your screen, and Mark and I will answer them towards the end of the presentation. Additionally, we are recording today's webinar and we'll be posting it online tomorrow. So feel free to come back to our site later to rewatch anything you may have missed. So Mark, let's begin today's session by talking briefly about the history of our program.
Okay, sure, Ariane. So how about if I start by giving a little bit of background information on our programs and our institution as well. So in 1898, Cornell University established Cornell Medical College. However, unlike Cornell's main campus in Ithaca, New York, the medical college was founded in New York City due to the many clinical training opportunities that were available here. Today, the college is affiliated with multiple New York City-based medical institutions, including New York Presbyterian, Memorial Sloan Kettering Cancer Center, the Hospital for Special Surgery, the Rockefeller University, and others. In 1952, Cornell University founded its Graduate School of Medical Sciences and began to offer PhDs and other graduate degrees. The institution was named Weill Cornell Medical College in 1998, and just recently we became Weill Cornell Medicine to better represent the breadth and depth of everything that we do best, including world-class patient care, cutting-edge research, and of course, top-ranked education. And that brings us to today. The Department of Healthcare Policy and Research concentrates on studying and improving healthcare delivery to optimize the value of healthcare for patients across the country. Dr. Renu Kaushal, the department chair, is an expert in healthcare quality, patient safety, and information technology.
So our department has some of the strongest graduate programs in our field. We have an extremely diverse set of students and applicants, including those recently out of their undergrad degree programs, medical fellows, and individuals in the field for 20 or more years. Today we will be discussing our master's program in health policy and economics, which can be completed in 1 year as a full-time student or in up to 2 years as a part-time student. Additionally, the program requires a research project and thesis, which we will discuss in more detail shortly. Our academic year is unique in that it is divided into 3 terms, fall, spring, and summer, covering 12 full months. Our master's program in health policy and economics is highly selective, and it trains students to be leading policy analysts and researchers working to identify the most effective ways to organize, manage, finance, and deliver high-quality healthcare.
So here's an overview of the Health Policy and Economics curriculum. Our MS in Health Policy and Economics builds on a shared set of courses, which you can see highlighted in red on the screen, along with our master's program in Health Informatics. These shared courses provide training in how the healthcare delivery system functions, how to ask questions about these systems to better improve them, how to use statistics to develop and improve policies and healthcare interventions, and how to work with large healthcare data sets. As the name suggests, our health policy and economics specific courses, now highlighted in orange on the screen, provide a strong foundation in health policy and economics. Students will become well-versed in the financing of healthcare, economic components of the delivery system, and the role of government. Understanding how incentives present in the nation's healthcare system, from ways that physicians and hospitals are reimbursed, to the regulatory requirements for the development and approval of new drugs and medical devices, influence the cost and quality of care is essential to keep up with the changing healthcare landscape and to provide the best care possible. Utilizing cutting-edge statistical approaches, our students learn to conduct rigorous analyses with healthcare data using computing packages such as SAS, Stata, and R. The results of these analyses allow them to better comprehend how changes in health policy and new interventions in the delivery of care may improve the health of people across the country.
And another unique aspect of our program is the research project. This is a required component that engages students in a hands-on research project that accumulates in our thesis. Each student works with a faculty mentor who provides training, helps identify and access healthcare data sets, and facilitates contact interaction with faculty and staff conducting research studies. So after completing their degree, our students have opportunity as researchers and policy analysts in the healthcare industry, federal and state health departments, research institutes, academia, and consulting firms. Employers in these fields increasingly need individuals with advanced skills in analytics, economics, policy evaluation, decision science, and implementation science. And our alumni are well prepared for PhD programs if they wish to further pursue their studies.
Okay, so the application is now live and you're able to apply at any time. We require 3 letters of recommendation, so be sure to start asking those who will be writing one for you. Once they're finished, your recommenders can send their letters directly to us by emailing hpr-education@med.cornell.edu. So we'll put that email address at the end of the presentation as well. We also require the latest transcripts from your undergraduate institutions, as well as from any graduate degree that you may have completed. You'll also need to write a personal statement that describes your interest in healthcare and/or health policy in this program. And you should also note that due to the overwhelming interest this year, we just announced an extension of our application deadline, so you now have until March 1st to get us your completed application. However, we would encourage you to submit it earlier, as you may receive an admissions decision sooner if you submit your application earlier.
So along with these requirements, simply submit the online application and the $60 application fee. You can, of course, reach out to us at any time to check on the status of your application. So 2 final notes about the admissions. We do not require standardized test scores for admission into our program. However, we do encourage you to submit them as they can help strengthen an application. Our applicants generally submit scores from the GRE, MCAT, or GMAT. And if you are an international applicant, we will need recent TOEFL scores.
Let's take a moment to look at our website if you haven't already done so. So let's click here and visit our education page. There's a lot of information that we invite you to check out, including more information about our program, faculty, upcoming events, and our application process. As we mentioned before, our application is now live and it's available here.
Great, thanks, Mark. Now let's go over a few questions that some of you submitted during our presentation.
Okay, so first of all, we have how is this program different from a typical Masters of Public Health? Okay, great question. So there are some key differences. I would say, for example, that most MPH programs tend to place greater emphasis on topics such as population health, epidemiology, nutrition, and patterns of disease. MPH programs also tend to be a bit more theoretically oriented, while our health policy and economics program is more applied with a practice-based focus. So our program emphasizes a broader policy perspective to include, for example, payment policies, health insurance coverage, and structural issues related to the healthcare delivery system. So the goal of the program is to prepare students to work effectively in organizations and also in the related policy environment as well-trained healthcare researchers with strong analytic skills. So from the time you walk into the door, you'll be working with data. You'll, as we mentioned earlier, have access to a variety of statistical packages which are incorporated into the curriculum of our courses. and you'll immediately start working with those software packages and healthcare data. And as Dr. Jung mentioned earlier, you'll have to do a thesis or capstone project, and that'll also be a data-driven project where you'll work directly with data. So you'll have a lot of experience once you complete your degree that you can demonstrate to potential employers. Okay, so we have a question about scholarships and financial aid. So financial aid, you'll have to talk to our financial aid office, but I think for graduate programs that typically involve loans. Now, some of our students have gotten scholarships in the past. It's not something that we guarantee. Those tend to be external scholarships offered by private foundations and organizations. But a number of our students also have been able to get jobs as research assistants and also teaching assistants. Again, we don't guarantee those positions, but quite a few students have obtained them once entering the program. Okay, so is this program very technical? Does it require quantitative skills as a prerequisite, or do you have to be an economics major as an undergraduate? So again, wonderful question, and the answer to that is no. So advanced quantitative skills or an economics background isn't needed for the program. The core courses which you take in the first term will prepare you for the more quantitative courses that you take in the second and third terms. For example, the core courses include introductory biostatistics and fundamentals of health economics. These courses will prepare you well for more advanced courses in the second and third terms of the program. So we have people coming from a variety of backgrounds. Some actually do come from economics programs. Others come from majors such as psychology or biology. I think we even have a journalism major this year. And we also do have a number of practicing physicians who have enrolled in the program.
There's another question about mentoring. So we keep our class sizes and student to faculty ratio low so that our students get the most personalized experience as possible. Because of this, mentorship by faculty members throughout the program is provided to all of our students. Many even continue their relationship well after becoming alumni and working in their careers. So our faculty within the Department of Healthcare Policy Research have over 170 years of combined experience and are experts in topics such as health policy, informatics, economics, health service research, biostatistics, epidemiology, cost effectiveness, and competitive effectiveness, and so on.
Okay, someone's asking, you mentioned hands-on data experience. What do you mean by that? Okay, so again, great question. So for some courses, the students will actually be given healthcare data sets. These could be healthcare claims, for example. I'm teaching a course called Health Data for Research this semester, and rather I should say term, not semester. And the students are given access to data on a server, and they're also given access to statistical software packages that we mentioned earlier. This, in my class, I'm using SAS at the moment, but they're also using Data and R and other courses, and they'll actually do assignments with those data files. Likewise, the thesis or capstone project, which every student is required to complete, involves working directly with data to complete a project. Okay. What kinds of roles and organizations do graduates move on to? So this is a question about job prospects. So after completing the degree, students will have a variety of career opportunities. For example, as policy analysts in the healthcare industry or government organizations. This might include, for example, state agencies or state health departments. Currently, we even have one student working in the New York City Department of Health and Mental Hygiene. Some students may go on to work at research institutes. Some may go into academia. Others may go into consulting. So many of these employers increasingly need individuals with the skills that students obtain in our program. For example, advanced skills in analytics, economics, policy evaluation, likewise decision science and implementation science. Also, if you're interested in going on to a PhD program afterwards, our program is well suited to prepare you to do that. As we noted earlier, each student is paired with a faculty mentor who will guide them through their thesis and throughout the program. And these individuals can also provide you with career advice. And I think also if you just take a look at some of the job ads these days for some of the organizations I was just describing, you'll find that the job descriptions are closely aligned with the curriculum in our program. Okay, I see cost-effectiveness-based courses, but we don't see much of that in the U.S. Will we be learning comparative systems, or will this be focused on U.S. policy? So most of our curriculum is based on healthcare policy in the U.S. We do have individuals you can work with in the department who can, for example, work with you on topics related to international health or maybe comparative healthcare systems. But most of the coursework will involve examining the healthcare delivery system in the U.S. and policy within the U.S.
However, the skills that you learn from the classes that you can apply to the studies that you're interested in, such as global health economics.
Okay. Do you accept any students without prior medical or economics experience? Absolutely. As I mentioned earlier, we have quite a diverse set of students. So I would say about a third of our current cohort came directly out of undergraduate degree programs. A couple of them were economics majors. Some of them were biology majors. We had one or two psychology and sociology majors. And I think we also had a journalism major. So no, you don't have to have a background in economics or medicine. Likewise, some individuals have a degree in an unrelated field and have been working for quite some time. So about a third of our cohort also consists of individuals who have been out of school for quite some time and have developed some work experience. And then the other third of our cohort, we currently have about 5 physicians from the surrounding healthcare institutions who are in the program as well. So you can see people come from a variety of backgrounds, and that doesn't necessarily need to be in economics or medicine. Okay, so someone's asking about collaboration. We mentioned some in our presentation, other institutions in the area. So again, great question. So being in New York City in particular is a huge asset for the program. So the local institutions that we collaborate with include New York Presbyterian Hospital, who we have very close ties to. In fact, the main medical school building is connected to the hospital. We're right across the street from Memorial Sloan Kettering Cancer Center. The Hospital for Special Surgery is next door to the medical college, as is Rockefeller University. And we also have very close relationships with both the State Department of Health and the New York City Department of Health and Mental Hygiene. They've had a number of collaborations in the past. We also have close ties to other departments in the medical college and also the main university campus up in Ithaca as well. And you may or may not be aware of Cornell Tech here in New York City. So that's a separate campus that's affiliated, that's part of Cornell University. And it's currently building a campus just a few hundred yards away from us on Roosevelt Island in the middle of the East River. However, they're currently holding classes at the Google campus down in Chelsea in Manhattan. And students, if they have the background for those courses, are more than welcome to enroll in those as well while they're completing the degree. I should also mention that some students asked about additional funding opportunities. So some of our students have been able to get research assistantships with organizations that are in the area as well. For example, we have one student who's working as a research assistant in a hospital in Brooklyn. And I mentioned earlier we have another student who's working in the New York City Department of Health and Mental Hygiene. And we've also had students who've worked at, again, numerous other institutions in the area. Okay, so do you require internships or work experience, broad work experience during the course of the degree? And no, you're certainly welcome to do those things, but they're not required. We do envision students, more students being involved in internships. We recently sort of shifted the thesis to a capstone project, which may entail an internship if that were to work out better for students. Likewise, you're still welcome to do a traditional thesis. So I hope that answers your question, but no, that's not an absolute requirement. Okay, can you tell me a little bit more about what faculty in your department are doing? Okay, so we have individuals with a wide variety of expertise in the department, including both healthcare policy and healthcare delivery. So they have substantial research strengths across a variety of areas, including healthcare policy, health economics, data analytics. We have a large informatics group. Additionally, we have faculty that have expertise in comparative effectiveness and outcomes research, and we also offer elective courses in those areas. So, their innovative quantitative and qualitative research will address a wide variety of questions that you might be interested in. And you're also, welcome to, you'll be assigned a faculty member, a faculty mentor once you enter the program. But you'll really have, we're a relatively small program compared to our competitors. And you'll have a lot of access to faculty members, and you're certainly welcome to work with more faculty members, and you'll have a lot of access to faculty members beyond your mentor as well. So I think everyone in the program finds our faculty very accessible. Okay, so again, we have students, some people submitting questions about specific topics that our faculty may focus on. And you may want to take a look at our webpage, the department's webpage, and look at individual faculty members to see where their expertise are. Again, we have people with a wide variety of backgrounds. We have someone asking on the website at the moment if we have anyone with expertise in vulnerable populations, HIV/AIDS, or LGBT health-related issues. And I think certainly you'll find faculty members who do research in those areas, and you're, again, welcome to take a look at our webpage and read about the research that our faculty are doing. Okay, well, those were wonderful questions. That seems like all that we have for now. Again, feel free to reach out to us anytime. We welcome your questions. That looks like all that we have submitted, people have submitted for now, so thank you.
Well, Mark and I wish to thank you for taking a few minutes to learn more about our Master of Science in Health Policy and Economics. This is such an exciting time to be in the healthcare field, and I'm so happy to see such a strong, dedicated students in our program. I hope to see applications from all of you. Please feel free to reach out to us anytime if you have any questions. I look forward to reading your application. Thanks.
Thanks, everyone. Good night.